Could you introduce us to Zeel?
Oh, yeah. Look, Zeel is a heck of a story these days because for those of you who've used it before, we're a technology-enabled massage therapy company. We come to your home and, we could get to your house before COVID in as little as 1 hour in 100 cities around the US. It was really a magical experience. We got it to $50 million of GMV annualized in February 2020, breaking even. And then COVID hit, and everyone knows within 2 weeks, March 13, we're at zero revenue. The platform shut down in every state in the country. We briefly tried to stay open in a couple of states, actually. It was really funny. There were a number of providers and customers who were like, it's up to me if I want to get a massage. And if the provider wants to work in my house, this isn't up to the state. So there's a bit of personal rights, which of course in America here, we're so fond of, it's in our constitution. But the states won over. There was just too much backlash. So we shut it all down March 13. And we had no revenue coming in for 6 weeks. It was the most humbling experience I've ever been through. And I've been through, the 1991-92 recessions, the 9/11, obviously experience for those of you who were in New York then, which came after the NASDAQ 2000 crash. And then, of course, the '08, crash. And so there was nothing quite like the COVID crash. But we summoned all of our resources. Everybody on the team was just a heck of a warrior. And we did everything you would expect. We cut all of the non-people costs in a matter of days and renegotiated every contract from Salesforce to our rent, that we could. But it became clear by the end of March that we couldn't spare people. And so we had to do furloughs, layoffs, and pay cuts and all that over the coming weeks and months. But thankfully, our government came through and provided PPP loans. I still wish they gave more PPP loans to restaurants and bars than they did to companies like ours. But we needed it because our massage therapists had no work. So we needed that money and we had to sprinkle it around. So it was very necessary to keep as many people as possible employed.
And so we're a year into COVID now, the pandemic. It's just about the anniversary of the start of it. How has the business sustained through that period? It sounds like you went into triage mode.
Yeah, we went into massive triage mode. Yeah. So here's what happened. And I like to say that, crisis begets innovation, because when you're staring death in the face, which is what happened on March 13th, we weren't going to wait for the states to reopen. I mean, as far as we were concerned, massage therapy in the home might be dead for a long time to come. So we immediately started working on an idea that my team and I had, I'd say at least 2 or 3 years earlier, but maybe didn't have the guts to pursue. And it took COVID to kick us in the ass to do it. And that is to become a medical practice. And we finally unveiled our medical practice in November this year. But we said this, look, we already know how to come to the home. We've been coming to the home for 8 years. At that time, we had delivered more than 1.5 million appointments to the home. Massage therapy is one of the most difficult in-home experiences to actually deliver. If you think about it, it's an hour, you're taking care of somebody in pain, and there's a serious trust and safety element because the patient is, getting down to their, gym shorts. They're going under, a sheet. The therapist, 80% of whom in America are female massage therapists, they're going to a stranger's home. So we'd worked out over the past 8 years before COVID, every little detail you could imagine around trust and safety, ID verification, GPS, insurance, the whole thing. So there's a high level of trust. So we already have that. We already are delivering care to the home. Why don't we just do more medical type care? Why are we sticking to this thing called spa massage? So that's what we did. In November, we unveiled our first medical service, which was COVID testing in the home. We started in New York, New Jersey, Connecticut. We've now serviced nearly 10,000 patients in the home. It's been an amazing experience. People are like, wow, somebody gets here in a few hours, swabs everyone's noses in a matter of 5 minutes. We courier the samples down to our lab in Brooklyn, and you get your results in under 24 hours. And you get the nice PDF that you can use during your international travel or for your workplace or whatever, right? So it's incredible.
What a convenient service. Now, I knew you had introduced the COVID testing late last year. I didn't realize it was part of a longer term plan of doing a medical play. Where does it go from COVID testing now that you've kind of opened that door?
Well, the healthcare practitioner who's coming to your home for COVID testing is a registered nurse, licensed practical nurse, so LPN, RN, or a nurse practitioner. These are highly skilled healthcare workers. So nurses are able to do a lot of things in America. So we're doing some blood draws. They can inject medication. I'm happy to announce today that a few days ago, we were approved by New York City Department of Health to be an official COVID vaccinator.
So, oh, wow. So it's going to be on-demand vaccines?
Well, on-demand, no, because you do have to do a lot of, paperwork, and there's some prep. And we're approved for J&J vaccine because we have a vaccine refrigerator here in the office behind me, but it's
vaccine at home.
Vaccine at home and in the office. We're really going to focus more on the office as a return to work strategy versus home. The reason is because it's very critical you don't waste a dose of vaccine, and each J&J vial has 5 doses. So we're still thinking through the home aspect, but you're going to have to do multiples of 5. So it's going to be a little bit tricky. But in the office, obviously, it'll be very easy to plan and coordinate everything. But yeah, I'm really excited. Right now, J&J vaccine is being developed, and so there's shortages all over the country. So I'm hoping in a few weeks we get our allotment in New York City, and we'll then announce it, right, in the emails and to all of our customers. I think it's going to be there's going to be gangbuster demand for this thing, and we'll go out and vaccinate people. So in some ways, we're doing our part, right, to get America back to work and back to normal, which makes us really happy. So that's the nurse aspect of it. And then, we're working on true to our brand, which is taking care of your, body, your injuries, your chronic lower back pain, right? Your sleep disorder, your anxiety, which is what massage therapy is for. We're applying that whole thing into the medical practice. So think medical massage, think physical therapy. We're adding those disciplines. We'll be making some great announcements here in the coming weeks and months of new lines of medicine that we'll be delivering into the home.